Introducing the dual testing microarray from MosaiQ. The antigen typing well features a panel of arrayed antibody probes specific against blood group antigens. Multiple clones of certain antibodies are included to reduce the need for repeat testing. A small volume of packed red cells is removed from the sample tube. This is added to the antigen typing well and mixed with a diluent. Agitation ensures homogeneity. After a short incubation, red cells adhere to the printed antibodies. The residual sample is aspirated and the well washed. Where the antigen is present on the red cell, specific binding has occurred to the relevant antibody. These reactions are captured by the instrument's high-definition camera for interpretation by the MosaiQ operating system. The antibody ID test runs concurrently in the well, adjacent to the antigen typing test. The antibody ID test uses unique human-derived red blood cells printed to form an ID panel unrivaled by any other blood grouping systems available on the market today. An 80 microliter volume of plasma is aspirated from the sample tube. This is then added to the well with a similar volume of proprietary diluent. During a short incubation, any blood transfusion-related antibodies will bind to antigens present on the printed cells. As well as blood group O cells being present, there are also blood group A and B cells, which allows reverse typing also to be performed simultaneously. After incubation, the sample is removed and the well washed. Subsequently, a detection reagent is added. Another incubation allows the detection antibody to bind to any patient or donor antibodies immobilized in the previous step. Once again, the reagent is removed and the well washed. A final enhancement reagent is then added, which allows the positive result to be visualized and interpreted. Positive reactions indicating that antibodies are present appear as black spots, which are interpreted by the instrument camera. In donor testing labs, there's a requirement for disease screening. For this testing, the unique multiplexed disease screening microarray can be used. Much the same as the antibody ID test, a small volume of plasma and diluent are added to the well and mixed. Antigens and antibodies commonly used in disease testing are arrayed side by side on the surface. If disease-related antibodies or antigens are present in the sample, these will bind to the appropriate probes. After incubation, the sample is removed and the well washed. Again, a series of detection reagents, followed by an enhancement reagent, are used to determine which diseases the sample may be reactive for. A black spot indicates a reactive sample and is captured by the instrument's camera.